see here. I'm going to walk around because I'm highly excitable, particularly when it comes to data. So I apologize. Good morning, my fellow nerds. I am so glad to see all of you here. You have self-selected for a conference called Data! That means I am not the only one in the room who has watched the Star Wars trailer approximately 7,000 times. So I'm so glad you guys are here today. This is going to be great. I want to encourage you to, when I can get this thing working, I want to encourage you to, what am I pointing at, Jennifer? Yeah, it's on. That's backwards. There we go. I want to encourage you to follow along in the conversation today by following us on Twitter at CradleCincy, CNCY. My slide is not advancing, so if you guys can advance it in the back, that's as far as I get. There we go. How about that? Let's see if my clicker works now. So I want to start with a story that a lot of you have probably heard before, and especially if you've been around the nonprofit space for very long. So there's a man and a woman walking along the beach, and they see thousands and thousands of stranded starfish that are just going to sit there and die because they're above the high tide zone. And the man bends down as they're walking, and every five minutes or so, he picks one up and he throws it back in the ocean. And after 5 or 6 of these, the woman says, "What are you doing? You can't possibly save all these starfish. There's thousands and thousands of them." And he looks at her very sincerely, and he says, I made a difference for that one that I just threw back. And my theme of my presentation today is that if you work in the social space, that story is complete crap. And you cannot get into that mindset. We have to be thinking about systems. In your personal life, absolutely. Change one life at a time. It is a life well lived if you change one life. Absolutely. If you work for a nonprofit that gets paid $5 million to solve education problems, and at the end of the year you have one happy story to tell about a kid who got that problem solved, guess what? Give his family $5 million. That's a better use of that funding. So that's the theme of today, and we're going to talk about it in the context of infant mortality because that's the space I work in. Very quickly, we have a big infant mortality problem in the United States. About 6 babies die for every 1,000 that are born alive. That's one of the worst among the industrialized countries. State of Ohio, 7.5 per every 1,000 that are born die, and that is 47th out of 50, so not great. Hamilton County is consistently among the worst 10% in terms of infant mortality around the country. So we have a big problem, and the question is why. This is the question I get all of the time. And the way that I never answer it, except when I'm in a room full exclusively of nerds, is we do not know. We have hints, we have ideas, we have suggestions, we have things to work on. There are specific cases where we know, but we do not have nearly the kinds of answers that we need on this. That's true for homelessness, that's true for education, that's true for whatever issue it is that you care about. We need better information. When we say we need better data, a lot of people shut down because they hated their high school algebra class, but all we mean by that is we need better information. So we do need better data. What we don't know is literally killing us and our children. We are extraordinarily program rich, lots of great programs. Lots of these programs have great data about their programs. My program's infant mortality rate is 2.3. My program's infant mortality rate is 4.6. We are systems poor. Continually, despite these programs, the infant mortality rate stays high in our community. That means that we need to think about this differently. Social service agencies use different measures and data systems, keeping us from knowing where the gaps are and what is working best. Despite our common agenda, we don't have any way to measure standard implementation, and an aversion to data can cause our community to work on the wrong stuff. Let me give you an example of this. I talk all the time about infant mortality, and I finish a 45-minute brilliant talk to people, and someone raises their hand inevitably, and they say, "So great, what are we going to do to solve this teen pregnancy crisis?" And I won't have mentioned a thing about teen pregnancy in the last 45 minutes. And in fact, the reason I don't mention it is almost no babies who die in Hamilton County die because they were teen moms. That's incredibly rare. We lost 1 baby last year to a teen mom. We lost 1 baby the year before to a teen mom. We lose more babies to moms who are over the age of 35 than we do to teen moms. But people bring all of these preconceived notions, these non-data-driven ideas, and there have literally been efforts in the past that have said, great, what we need to do is get to teen moms and prevent pregnancy in the teenage years, and that will solve our crisis. So we have to obsess about this stuff, or else we're going to be focused in the wrong area. Very quickly, 7 steps for using data to build strategic solutions. I'll go into each one of these. Develop a focused, common agenda. Gather and regularly report on as much data as is available. Create a culture around data. That's part of what we're doing today, right? Understand the complexity of the system. Understand the size of the gaps. Use continuous improvement methods to improve in partnership and finally unite around a true shared system of data. So one at a time here. Develop a common agenda. Here's what we mean by that. On the left here, we often start with chaos. There's lots of noise. When we started our work in infant mortality, we went around and asked hundreds of partners, what is it you think is causing our high infant mortality rate? Give us any indicators that you think might matter. And we came up with a list of 150 indicators. Lots of noise, hard to organize. We went through a process of getting that more organized, and we got down to a list of indicators in pre-pregnancy health, in pregnancy health, and in first year of life health. About 30 of them that we continue to report on an annual basis. We say, hey, we care about these things. These are important. We want to continue to measure them. But then the real magic here and the real hard work and the part that makes me a pretty frequent enemy of people is to obsessively focus and get down to just a few things that we want to do as a community together. So to bring that down to, in our case, 3. We obsess about safe sleep for babies, about spacing in between pregnancies. If you have more than 12 months in between your pregnancy, you're significantly less likely to have a preterm birth with that next child. And about not smoking during pregnancy. That's our common agenda. Are there other things we can work on? Yes. The data tells us, the community tells us that these are the things that we think matter the most. Could that agenda expand over time? Absolutely. But I would rather spend $3 million on 3 things than $100,000 on 30 things. And it's not just money that's a resource that's limited. It's also time. It's also the attention span of the community. If the people you're trying to influence can't tell you what your agenda is, can't remember it, then you're lost before you start. Gather and report on as much existing data as possible. So we do this in 2 different ways. We issue an annual report, and we issue a monthly report in partnership with Hamilton County Public Health. Tom's over here who does this with us. And the great thing about this is just getting as much information as we have. Is the information perfect yet? No, it's not. But we want to push it out there. We want to be very open and transparent about this. We love our annual report. We use incredibly plain English. We use beautiful photography. We tell a story. And because of that, we take what is at its heart a really geeky data report. And last year it was downloaded more than 10,000 times. So people are engaging with this issue because we tell a story about it. Create a culture around data. This is something that's tough to do. One way we do it is we have a blog. On our blog, the most popular blog posts that go up are family stories and touching stories of harrowing pregnancies and things like this. But we interweave within there really geeky stories about data. And that just keeps reminding all of our partners that we really care about this thing. We start every meeting of our collaborative with a data slide. Here's an update. Since we came last time, here's how many babies have died. Here's how many babies were born preterm. Here's what's happening in spacing, smoking, and sleep. We start every meeting this way so that my theory is if I ever skipped this, one of our partners would raise their hand at this point and say, hey, we need the data. Tell us where we're at as a community. Understanding the complexity of the system. There are 23 centers of prenatal care where moms on Medicaid get care in Hamilton County. These systems don't always talk to each other, don't even know what each other are doing. They measure things differently. They store data differently. Similarly, there's 14 social service agencies designed specifically to help moms in pregnancy. They measure things differently. They don't always talk to each other. They have different agendas. So the very starting point is just sort of mapping the system out. And then once you do that, you have to understand the size of the gaps. So 44% of moms on Medicaid are not getting adequate prenatal care. It's a number that has to change. It's a number that we have to be motivated by. And I'll talk in a second about some things that we're doing about that. And then 79% of moms aren't getting the kind of social support that we know makes a difference from social service agencies. And this number was shocking to our community. We got all 14 of these social service agencies together, and we said, hey, how many people do you serve? The first thing we heard, guess what? Agency 1 said, we served 2,000 women last year. Agency 2 said, we served 1,500. Agency 3 said, we served 3,000. And I added all these numbers up. I said, oh, we're getting to everybody. This is great. A couple months went by, and I said, well, let's ask this question a different way. if you only count mom and not mom and baby as two different people, if you only count mom once and you don't count her the second time you see her as a second person, the third time you see her, the fourth time you see her, if you leave the room to go to the bathroom and come back, you don't count her a second time. How many women did you serve? And it turns out that out of the 4,500 women who give birth on Medicaid every year, these 14 agencies combined got to 913 of them before they gave birth to their child. So huge, enormous gaps. That gives us information that we can use to go advocate in a real way to the state. We can use to go advocate in a real way to the United Way and say, there is a real gap here. We want to use continuous improvement methods to improve in partnership. What that looks like for us, we have all of the providers of prenatal care in Hamilton County connected through the Cradle Cincinnati Learning Collaborative, and they are obsessively measuring 12 things about their practices and trying to improve them, all aligned around this pretty simple common agenda, and using quality improvement methodology to change the way they give care. Finally, the vision for all this is to unite around a shared system of data. We are not there yet, but what if medical providers actually had a way of knowing what social programs their patients were accessing? That's not currently possible. What if social service providers had a way of knowing how they were doing against commonly agreed upon benchmarks? What if funders, I know there's funders in this room, what if you could actually tell which program was the best one at what they were trying to do? That's not possible in the space we work in currently because everyone's measuring things differently. There is an example of this, and it's going to transition really nicely into Michelle in town. The homeless system does this really well. There are 101 programs that serve homeless people in Cincinnati. They're united around a single system called VESTA, and this allows for kind of no wrong door policies in the homeless center. You walk into the city gospel mission, and they can tell, oh, I see that last night you were at the drop-in center. I see that you got bus tokens. I see that these are the services that were provided to you, but I see it's been a month since you've had these services. So let me offer those to you today. This is an entirely different kind of understanding. It's what we need to get to in lots more sectors. So with that, I just want to go back to the starfish real quickly. If an agency that you fund, if an agency you care about, you love, you serve on the board of, you volunteer for, is throwing starfish, you need to start asking them, are there fewer starfish on the beach than there were before you started? That's really what has to motivate us. I only care over time if the infant mortality rate in my community goes down. I do not care if the programs got better. I do not care if we got extra special grants. I care if the infant mortality rate goes down, and we have to work together in the social sector in order to unite around that kind of change. Thank you, guys.